Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Harry Simpson, 10/2/1958.
Okay, and do you know where you are, Harry, today?
Hospital,
And do you know what today's date is?
April 10th, 2020.
All right, awesome. So everything is cleared out of her way, or out of his way to walk. Her IV is patent. It's not red. It's not tangled up. She has no urinary catheter, so there is no tubing to check. If it was, she would have an unkink, so it would be hooked to an immobile part of the bed. So I'm going to go ahead and I'm going to do a little assessment on you and look at all of the stuff that shows why you're here. And then we'll get into why you're here and if you have any questions for me, okay?
Okay.
Alright, so I'm going to go ahead and have you look to your left. Alright, and look to your right. And no JVD distension. I'm going to go ahead and take a listen to your heart and lung sounds, okay?
Okay.
Alright, go ahead and lean up for me and I'm going to check your posterior. Alright, go ahead and lean back for me. Do you have any tenderness in your stomach?
No.
No? Alright. I'm going to go ahead and listen to your bowel sounds and I'm going to go ahead and palpate those for you. Alright, let me know if this hurts for you, okay? Alright, lung sounds are normal. She has no crackles or wheezing in her lungs. They're very clear. Bowel sounds ×4. She is soft and flat, no tenderness. Do you have any pain in your upper extremities?
No.
No? Okay.
I have pain in my right knee.
You have pain in your right knee? Okay, when did your pain start?
3 days ago.
3 days ago. And what would you rate that? 0 being no pain and 10 being the worst pain.
8 out of 10.
8 out of 10. Does it go anywhere or does it just stay in that knee?
Just stay in my knee.
Okay. And how would you describe it? Is it aching? Is it a dull pain?
It's aching and throbbing.
Aching and throbbing? Okay. So she has warm pink skin. She does have some nodules on both hands. Her right knee is swollen, it's tender, and there is redness and heat coming off of that. Is that the only place that you have pain?
Yes.
Okay. Go ahead and push on my hands for me if you can and pull down on them. Alright, awesome. She does not have any swelling in her ankles. Her capillary refill is less than 3 seconds. Alright, I'm going to have you push down on my hands and pull up. Alright, awesome. So, since you do have some nodules and some pain in that right knee, that kind of gives me a little bit of questioning of if you have like a gout flare-up, if you have some osteoporosis, or some type of arthritis going on. So, what we're going to go ahead and do is do your vital signs. Your vital signs were looking good when you came in. But we're going to go ahead and do some laboratory tests just to see what kind is going on. So those different lab tests are going to rule out whether or not you have, or what kind of arthritis or something that you're having going on. So we're going to check your CBC. We're going to look at your uric acid levels and your ESR. When we look at your ESR levels, or your uric acid levels, it kind of shows if you have gout, and that is what we're kind of leaning towards. But we also want to look at the shiny nodule that's on your elbow, because that could be lymphedema. So we'll go ahead and take a blood test as well, and we'll look at those to kind of see what that is, okay? So what is going on is you're having, with everything that's coming back, you're going to have a gout flare-up. And ways that we can tell that are just those uric acid levels. Do you have any questions for me right now?
Yeah, what medications might I take?
So with a gout flare-up, we could prescribe you many different types of medications, but the most ones that we probably are going to give you is colchicine and allopurinol, and that helps kind of slow down those flare-ups. Any other questions?
How to reduce floor hair ups.
Okay, so ways that we can help you reduce those flare-ups. And when you came in, you did kind of talk about having a glass of wine every day. That's okay, but we like you to limit your alcohol consumption because that will cause some flare-ups. When you do feel some type of pain coming on or you're having some stiffness, making sure that you're resting those joints and icing those to help with the redness and the swelling. You can take an anti-inflammatory to help with the inflammation as well. When we do prescribe you the medications, we want you to make sure you're actually taking them when you're supposed to be taking them, not skipping any doses. And then also, we like you to decrease the purines in your diet. The way that you do that can cause the uric acid levels to be lower in your system when you take in those purines. And you want to maintain a healthy weight. So making sure that you're still getting your exercise in, but stopping when you do feel that pain and resting, and then you can continue to go, but making sure not to push it over the limit. You also want to make sure that you're drinking a lot more fluids, so making sure you're taking in more water, the 2,000 to 250 ounces a day, milliliters a day, just so that you are flushing out that uric acid in your urine. So if you aren't drinking enough, the uric acid is going to continue to build up. And when that builds up, that's when you're going to see the flare-ups. So drinking all that water and kind of excreting those out is going to help. Any other questions for me today?
No.
All right, so what we're going to go ahead and do is give you an anti-inflammatory and prescribe you some physical therapy. And that should help with your inflammation, the joint swelling, and you're going to be able to walk easier without the pain from physical therapy. And hopefully we're going to get you discharged today, okay?
Okay.
All right, you are all set, so go ahead and just hang out for a little bit, and then I'll get all your paperwork, okay?
Okay.
All right.